Curvo is that mitigation that allows me to break down categories or allow me to understand the different subset of items that suppliers offer and how I can take those and make sure that I understand what my physicians are looking for and how to get the best prices from the suppliers using that. My name is Andenet Emiru. I work for the University of California Office of the President. We have a health division that entirely supports our medical centers. And University of California has 5 medical centers, and we're in charge of supporting them from a strategic sourcing standpoint. Since we have 5 large medical centers and they all have their own individual supply chain teams, contracting has always been done individually at those 5 medical centers. So we really have not in the past utilized our economic of scale to impact our contracts, to negotiate on behalf of the whole university system. And we were looking for a system that would show us the different prices that exist or opportunities that exist within the university system, and quickly to be able to do that. And that's what brought us to Curvo. Curvo's advantage, in my experience, has been their nimbleness, their willingness to listen, take feedback on how to make it better, how to customize it to the individual needs. And they really roll up their sleeves. They show up at our strategic meetings, and they listen to the clients, and then they create and they recreate. And it's that iteration process of taking something and making it work. Short-term results almost immediate. We were able to look at if any of our facilities are getting the best pricing, and then if so, we can go back and ask to make sure that best pricing is available right across the system. The other is and just you can look at internally right within the system, but then you also have the ability to look at it externally, and they have the benchmarking capability to show you a view of, look, you may be paying X price within the system, but then here's how that compares compared to other facilities that Curvo tracks. So one of the categories that we want to make sure we have competitive pricing across all of the items in that category is cardiac rhythm management. So those are things like pacemakers, defibrillators, loop recorders, all relating with your heart rhythm. So one of the things that we were able to work with Curvo on is understanding what that category is, understanding the difference between the category within the cardiac rhythm management, what categories exist, and then how to differentiate those. There's 4 main suppliers that provide product in those categories. When you look at pacemakers, being able to look at amongst those 4 suppliers, what are all the offering? What is the difference between the pacemakers that they offer? And how do we take that and translate it to the way physicians address or pick a product for their patient that's experiencing heart rhythm issues? So in conjunction with, in partnership with Curvo, we were able to look at that, understand it, dissect it, and then go back to the suppliers and say, look, here's how we want to address this category, and here's the pricing that we're willing to accept, and which is fair. We were able to save this system $4.1 million just in that cardiac rhythm management.